ChesPenn since the 80s, I think.
Wow.
Yes, you're correct.
It's a pleasure.
Hey, Miss Sue Harris, welcome.
Welcome. Thank you for having me. We are grateful to be presenting with you today.
Yeah.
Oh, thanks for being here.
It's a great opportunity.
President and CEO right here, y'all.
Right here.
That's what I'm talking about. That's what I'm talking about. This is what leadership should always look like.
Yeah.
So can you tell us about ChesPenn? I mean, I've heard of it growing up. Tell us about what it is and how long you've been here to serve the community of Chester.
Sure. ChesPenn Health Service has been in the community of Chester since 1973. They started out in a trailer, a double-wide trailer, given under Dr. Yagnick, who was a pediatrician providing care for uninsured children of Chester. They started out in a double-wide trailer on Tillman Street.
Wow.
And now to current day, we're here at this office right here, located in 125 East 9th Street in Chester.
Nice.
And we expanded those services since then to include adult care, OBGYN, behavioral health services, dental services.
Wow.
We're going to go through all those. So adult, behavioral health, OBGYN, dental, and pediatrics.
And pediatrics.
And pediatrics. Y'all busy.
Yes,
1973.
we
That was a long time ago.
Yeah.
They handle every category.
And we've been in
That's
Chester.
major.
In Chester, always on 9th Street.
Yeah.
Or we was on Welsh Street.
I remember
so we've already
on Welsh
been in the
Street.
community.
Yeah.
Right.
Now, tell us about the credentials your providers have. Since so this is a clinic where people can come if they don't have insurance, right?
They could have insurance, uninsured, doesn't matter. We don't turn anybody away.
That's good. And I think that the perspective of some people is if it's a free clinic, the care must not be good. So can you tell us about the credentials that your providers have?
Yeah, all of our physicians are board certified.
Okay.
Yeah, so everybody
Board
has their
That's hard.
Yeah, this.
That's a lot of testing.
yes.
That's a lot of study and a lot of testing. That's good.
Yeah, we've heard that before in the community. Sometimes we say, "No, they're not real doctors."
Yeah.
You know, yes, they are.
Wow.
I think for our doctors here, they have a passion for the community.
Yeah.
Right.
So that's one of the reasons why I think that makes them even more special, because
Yeah.
a lot of people chase the money, where our providers chase the community for it to be their health.
That's deep.
They want to be here.
They want to be
So
here.
that's a big
they
thing.
all
I gotta get
choosing to be here.
Yeah, they want to
Yeah.
be here, and that's important, and that's pretty much why we really here today. It's actually really a landmark. So, and we proud to be here with you. I got one question though. So I know you told us about the process, but say I'm a brother and I just want to come in and just get some get a checkup. I'm a 40-year-old man. I want to see. I just want to get a checkup for the first time. I never did this, but I want to start getting invested in my health.
All right, so the first thing starts with an appointment.
Okay.
And then once you do the appointment, you'll have an appointment with Dr. Islam or one of our other physicians. Dr. Daniel Williams. She's new with us, so that'll be that. You will get your blood work done. You will share your concerns, and in that way, if you have anything that's really vital to you, they can start with that and then go through everything else. So you'll get a complete workup and blood work done.
All right, because I think Okay, good.
Yep,
Because I think I'm going to do it.
Yes.
I'm going to do it.
Yes, and that was Sheila in the background.
That's what I'm talking about.
Yeah, and we also have So if you don't have insurance, we have enabling services as well that will qualify you for insurance. They'll do all the paperwork, assist you with that, so you can get insured.
And
So
I
you
got
can-
one bonus question.
Let's go with the
All right.
bony.
All right, this is the bonus question. All right. Now, this came from one of my friends. I'm not even going to mention his name.
We ain't gonna say no
but
names.
He owned this company. But listen, he said, this is only known for STDs.
Talk to the mic.
I'll keep the mic. This is not the only thing that goes on here.
Can
right?
can
Go
I
ahead,
just-
elaborate.
I just want to elaborate a little bit.
Go ahead.
So there was this person who had high blood pressure. He didn't have his medications, and he didn't have a doctor because he didn't have insurance. So we were talking about, I said, go to ChesPenn. They can help you. His response was, I'm not going to ChesPenn because if I do, people are going to think I have an STD. And so our question is, why do people feel like this is a STD clinic? When you said it's dental, it's pediatrics, it's adults, it's behavioral health. You ain't say nothing about an STD, but in people's minds, they feel like it's a it's an STD clinic. Why is that?
I think it's some of the perceptions, and I also know, like, at one point when the State Health at 5th and Penn had closed down. And we said that we would take on the patients that needed STD services.
Right.
So STD services is one of the services that we do provide because it's still with healthcare.
Right.
Yeah.
So so I think that's what happened when people said, "Oh, that's for STD." We had the same issue back in the day when HIV was prevalent, and we providing those services, and everybody's like, "Oh, they only do HIV." No,
Right.
if it's a health concern, if it's a condition, we can provide healthcare services.
Yeah.
That's amazing. So how can people contact the office to schedule an appointment?
They can call 610-872-6131 and go through the prompts and use for the schedule an appointment.
Nice.
So this is for people who have insurance, people who do not have insurance, people who do not have a doctor.
Mm-hmm.
What's the average bill for a person that comes here?
So if you are uninsured and it was a sliding fee that you fill out the application, and it starts only from $10 up to $16.
Okay.
That's for medical services, and our dental services start at $30. But we also have the nominal fee is $10. If people don't even have the $10, we don't charge that. We can waive that.
So a person can come here and get full medical care and not
For
pay
free.
anything. And I have insurance,
Nothing.
and I'm paying about $600
That's
out of
amazing.
my check every month. And on
amazing.
top of that, I have to pay a percentage of my doctor's offices. So it's great that we have these community health clinics available. They're all over the world. They're called FQHCs, federally qualified health centers. And I forgot to give a shout out to Dr. Thomas. Dr. Thomas is watching
Dr.
on
Thomas.
Facebook, and
So-
she is in the chat. So if y'all have
That's our sister.
questions,
What's
if
up,
y'all
sis?
have comments, pop them in the chat. She's probably already out there with y'all. I forgot. I'm off today.
got good
I'm
vibes.
outside and I'm just all messed up. Dr. Thomas can drop the link to the FQHC. So if you're not in Chester and you need to find one where you are, she can make sure you have the information you need. Hey, Dr. Thomas.
What's up, Doc?
I would also add too, if anybody who has insurance, a lot of times even with Medicare, you have a high copay. By us being an FQAC, you can also qualify for the sliding fee discount to get your copayment reduced. So if you might have a $50 copay, but you come here and you might just pay $10.
That's good to know. So people with Medicare can come, and instead of paying your copay that you would typically pay to see a doctor, if you come to a facility like ChesPenn, you can get that waived. That's a big deal because people are on fixed income.
Correct.
Right.
So you are dropping it, President and CEO. Let us know what's going on in these streets. Well, thanks for coming out
Thank
and
you.
talking to us today. That was very, very helpful. I hope someone got something. Can you repeat the phone number again in case anybody wants to schedule an appointment?
Sure, it's 610-872-6131.
Thanks, Miss
Wow.
Harris.
Thank you.
Have
I'll
a good
see
day.
you soon.
All righty. I'm looking forward to seeing you.
All right.
Gee,
Yeah, I'm showing
she's about
off.
to have a doctor.
I'm showing off.
I don't even think I knew that you didn't have a doctor.
I don't.
I don't think we talked about that.
Oh boy, I'm gonna get this long text, but it's cool. Listen. But no,
She
I'm
come up.
working on it. You know, this is what it's about.
That-
you gotta
that
wake
is.
people up and get people to start doing the right thing.
That is. Hey,
Hello,
Dr. Turner.
guys. How are you?
We're good.
How
Just
you
be
doing?
quiet
Good.
to the
Nice to
mic.
meet
you.
Good to see you. So I remember we worked together with Dr. Messum's clinic, and I was like, she is so nice. She's so great. I would love to do something with her one day. So
we're
thanks
happy
for
to have
coming
you
out.
guys.
Yeah,
Thanks
yeah,
for being
thanks.
here.
So Dr. Turner is a pediatrician. Can you tell us a little bit about the common reasons that people bring their children here?
Mostly for well child care, including just making sure development is up to date, growth is up to date. Shots, of course, is a big.
Oh, we're
player.
gonna talk about
I'm
shots.
sure we
Oh,
will.
yeah, definitely.
But we see children from newborn care, so as soon as parents are released from the hospital, usually around day of life 3, 4.
Wow.
Then every couple of weeks, then every month, and every couple of years, all the way to 21. We usually say
Wow.
18, but we kind of push it,
Oh, yeah.
to adult
Yeah,
age
just
to
to
try
stay
to
in the care.
transition
Yep,
them,
yep.
especially if there's any chronic medical conditions that the pediatrician has been following. So we don't want to kick our children out, and we hold on to them, but typical ages like newborn care up until 21.
Wow, that's great. So coming out of the hospital, so for women who are pregnant, who may not have a pediatrician in mind and not exactly sure where they want to go, this is where you go.
Here. The good thing, too, is a lot of our families get their OBGYN care here. So it's a nice transition from family medicine to OBGYN to pediatric care. And it's like a full circle here.
The whole family can come here.
Absolutely.
I didn't think about it that way. Wow. Well, y'all got a gym right here in Chester. I don't want to hear about anybody that don't have a doctor. I don't want to hear it from anybody anymore. I'm done.
Wow.
It's over. That conversation is just over.
Right.
So let's talk about kids vaccines.
Yes.
Oh, yeah.
Now, I know COVID is a big thing, but before we even go into COVID, I just want people to realize that giving multiple doses of a vaccine is very normal. It's normal. Like, you never have a vaccine where you just give one dose.
When we
Is that true?
Yeah, when we first started giving the COVID vaccine, I tried to talk to parents more so about the flu shot. Like, the flu shot is a vaccine that, because viruses change, viruses are smart, we have to adapt to making sure that our bodies are also fighting off the infection. But even more importantly, at the 2-month visit, the 4-month visit, the 6-month visit, we're typically giving a lot of the same vaccines. And that's to your point, that you want to boost the immune response so that when the body does unfortunately come into contact with these viruses, that we are protected against them. So I think that with COVID, because of, unfortunately, the impact that it's had on our community, on the world, that we don't really think about, like, wow, well, your body has been getting the same amount of the same vaccines for infancy, like 2 months, 4 months, 6 months, 1 year, and we boost the immune response for that reason. Yeah. So I think we kind of forget, and that's a good point. I actually never even really thought about it. I always thought about the COVID shot as being kind of equivalent to the flu shot in terms of a seasonality
having
of
to
it.
change it.
Mm-hmm. But the body has to kind of boost their immune response for all of the shots, including COVID, flu shot, measles, mumps, rubella, chickenpox, all of the things that we don't think about as much because our bodies have been protected, or most of our kids have been protected from it for so long. But I remember having chickenpox, like
Me too.
and I haven't seen, knock on wood, I haven't seen it because we vaccinate most
I was going to
kids.
ask you, how often does somebody come in here with chickenpox?
I have not seen it.
That's a big deal.
In training, you kind of, we had more unvaccinated children or different communities or different immigrant populations where you might see a rash that may make you question chickenpox, but we don't really see it because we vaccinate against it. Right. And I think that that's something that if it's out of sight, like out of memory, you don't think about it in that way. But I
remember when I first started learning about vaccines and I learned about chickenpox, and I was like, my mom must have been an anti-vaxxer, because why did I have chickenpox? But it was because it just wasn't available yet. It didn't become available to the mid-90s. Yeah, but, I ain't that old, but I'm like,
we had the natural response to it. Yeah.
So how important is it that parents get their child vaccinated against the flu? Is that something that we should be thinking about for our children right now?
I think it's really important. I know that there's a lot of mixed concerns about the flu shot, and the most common thing that I hear is that once you get a dose of the flu shot, your body kind of feels sick. And I try to help even my family members and our patients realize that means it's working. Like, if you get a touch of the flu shot, is better than getting the actual flu, or if you do get the flu, hopefully it's milder because your body has been introduced to what looks like the flu. So I think it's really important, especially as we're hopefully getting out of COVID. I don't know. I'm scared to say that, but especially as we're moving past, like the
people
vaccinated. More people vaccinated.
We found solutions to combat it a little bit.
Yeah. So the flu shot is important. It's important for us, like as providers, we get the flu shot to protect our patients. It's the same for our patients protecting their family members or older family members who might not be able to fight off the infection if they do get it. So I still push for the flu shot, and we've been doing the flu shot and the COVID shot at the same time.
They can get them both together.
Yeah.
Can you repeat that again, please?
So you can, and you can definitely do it. We have been trying to separate the COVID vaccine. If it's the first time you got the COVID shot, we use one arm. Yeah. We put everything else in the other arm, especially if you've gotten the flu shot before. And mostly if you have a skin reaction. We've had so many kids down to 6 months old be vaccinated with. That's when we start the flu shot, and that's when we have the approval for COVID vaccine. And every kid has done fine here. We only had one child with a skin reaction.
Okay.
And even that, we consider it mild, because if you're injecting anything, any medicine, any vaccine, any lotion, any cream around that area, you could have a little skin reaction, but the kids have been doing great.
So all the kids that have gotten the COVID vaccine here have been doing fine. There have not been any problem, except for one child that had a mild skin reaction. Can you just tell us how extensive was the skin reaction? Did they go to the hospital?
No,
or was it like,
no. We usually kind of warn against, like, if you notice any rashes. That's with any shot, like any vaccine, especially when kids sometimes have eczema, or they have like common skin rashes in general. You can even have a rash from a virus. So it's hard to say if it's actually the vaccine, is it the needle, is it the alcohol, is it the Band-Aid, like is it the preparation for the shot, or is it the shot? So we're so accessible that if there is a reaction, usually parents just come in and like, can you take a look at it? And that kid was fine.
Okay. All right, good. Good.
Wow.
I wanted to ask you, so you're a pediatrician. What's your top tip to share with parents who have small children? Like, I'm thinking of like 5 and below. What do you want us to know about providing care for our child? Like when to see the doctor, or what's, like a thing that you wish parents knew?
The importance of developmental screening. So when kids are little, especially around that infant age, parents know, like, oh, my kid has to get shots. I got to come every 2 months. But especially around that 1 to 5-year-old mark, there's a big gap between when shots are needed. So sometimes parents assume, like, everything's good, I don't have to go to see the pediatrician as often.
Wow.
But it's not, we don't want to just push shots. Like, we're here to make sure your kid is growing well. If you have any social needs, we can try to help. We do screening for autism, developmental delay, because the last thing we want to do is miss the mark for when we're doing the screening, because then it gets to the point where it becomes not too late, but delayed, and we can catch speech delays or other issues that parents, especially if parents have other kids, they're probably more experienced than me, like in terms of watching if something is not completely right, but maybe we can kind of catch things before it gets to that point, so we can do referrals and do more frequent monitoring.
I think that's a really good point. My son has a developmental delay that was called when he was about 1.5 to 2 years old, and he's in speech therapy now. So if I didn't get that screening done, I wouldn't have had known to connect him to services to help him as he continues. And so I think that's a really good important, just to remind parents, it's not about the routine vaccinations, but come in and check in with your providers to get those screenings done, to make sure that everything else is moving in the right direction for your child.
And so that you don't feel alone. Like, we're here to try. I know things are kind of limited with access to care and wait times, but at least we can try our best to bridge the gap. Mental health is a really big thing right now. There's not a lot of access to therapists in this area. So let us try to help where we can, or prescribe medicines, or do therapy, that kind of stuff. So it's really important.
Excellent. Well, thanks, Dr.
No
Turner.
problem.
I know you're
Thanks for
busy. You
having
probably
me.
got a lot of babies in
Giving
there.
COVID shots, flu shots right now.
All right.
All right,
Thanks
thank you
for
guys.
coming.
All right, have a good one.
Nice talking to you.
Wow.
That was a good one.
Man, it's a
Get
lot of
the
stuff going
screenings
on
done.
here.
Parents with little kids, get your screenings done.
Yes.
That's really important. It helped little Noah. He got an in-home speech therapist. Hey, Dr. Islam.
How are you
the
guys?
doctor's
How
bus
are
right in.
you?
I'm good.
Right out.
Good. Thanks.
How you
Thanks.
doing, Doc?
Fine,
Thanks
I'm
for
fine.
coming on to the show. I want to introduce you to your new patient. His name is George Mink Jr.
Oh, wow. How you
George,
doing? Nice to meet you, sir.
why
Yeah,
don't
we'll
I
come
see
in
you
here.
early then?
He just signed up today.
Yeah.
You have to speak into the mic.
Okay, yeah.
So George is going to be your new patient. He just signed
Excellent.
up today. He is
Should have
excited.
come earlier.
I know, but this is the thing. People didn't realize all the services that ChesPenn offer, and that's why we're here. So when he found out he can come here because he doesn't have insurance, he was like, I'm gonna schedule an appointment.
Yeah, I'm a
Good.
schedule.
Yes, we see.
And we got benefits. now,
Anybody
Doc.
who comes.
Yeah,
here.
we just got employee benefits.
Sure,
You-
got
you-
it.
even if you don't have benefits, we see patients without insurance. That's one of the main reasons we are here.
Yep.
Right.
You know,
Appreciate
I mean,
it.
we may not be able to do everything, but we can do the basics for a
Right.
patient who has
Right.
no insurance. You know, we have the pharmacy here. Even uninsured patient
Okay.
with this pharmacy can get medication at a very abbreviated cost.
So there's a
Affordable
pharmacy.
cost.
I